Hi, Corine. Welcome to the Integrative Health Coach Success Podcast.
Hi, thank you for having me.
Yes, our pleasure. I'm looking forward to you sharing your unique journey to kind of, more of an integrative health approach from what you were doing. I'm excited for our listeners to hear your story. If we could start by you sharing a little bit about what you currently do. So kind of what does your general practice, general day look like as of now? And then we'll back it up a little bit and talk about how you got there.
Absolutely. So whenever someone asks me, what do? I always say I'm an integrative health and functional medicine pharmacist. But there are many umbrellas to that. So in addition to doing integrative health, I also still have a strong passion for pharmacy. And so I have a Cbd and Thc business, as well as a medication therapy management umbrella. And so in the medication therapy management, we really focus on taking a deep dive and seeing what medications patients are on to make sure that there are no interactions or just that they don't need to be on all of the medications. A lot of times we find patients are put on medications for various reasons. It could be indigestion and heartburn, and then no one ever goes back and takes them off of those medications. Mm-hmm. So we really just try to slim down those profiles and make sure that everything that they're taking is necessary. And then as far as the Cbd and Thc, what I found is that Cbd hit the market and it just had such a strong presence that everybody wanted a piece. And so you can pretty much find Cbd anywhere, right? You can go to the corner store, to the hair salon, everywhere, but no one is really doing any consults to really make sure that the patient is taking the right medication for what they need it for. And so that's what we do also. We do Cbd consults. Again, we look over all of their medication. We look at their disease state and diagnosis and make sure that they're choosing the right medication that's for them. And so that's been a very, very important part of what we do. But the big umbrella is Integrative Health Practitioner. And so that's what I do now. And I really, really enjoy it.
Okay. Wow. It's so interesting because you're kind of like having two worlds collide and taking like the best of both worlds, right? Because there's some people that medication is necessary, but you're making sure that they're taking it in a way that's effective and not an overuse, or there's, ways that we can kind of get in this, like you said, cycle of, I don't know, I've been taking this for 3 years. I'm just still taking it. And, checking in and doing that kind of necessary follow-up care that we know is important in, more of that functional setting, but it's also important in the conventional setting too. And that's sometimes where you can miss the mark.
Yeah, absolutely. You hit it on the head because it's so many times that, especially with older patients, they'll come in and they say, yeah, I know I take 7 pills a day. I take 2 green ones, 1 red one, but I really have no idea what they're taking or what each medication is for. And so as a pharmacist, that's kind of where I come in, just to make sure, again, you're taking the right things for the right disease state and you actually need it. Why put that amount of stress on our bodies if we don't need the medication? So that's what we do. We get in there and really do a deep dive into the medication.
Okay. Yeah, that's so great. So I would love for you to share the listeners how you got from A to B. So you started out as a doctor of pharmacy, so in traditional pharmacy settings, and now you're in more of a functional space. So I would love for you to share with them how you kind of transitioned or why you transitioned from one to a more integrative approach.
Okay, awesome. So how did I get to where I am? So it's definitely been a journey. So I've been a pharmacist for about 15 years now, and I absolutely love being a pharmacist. But the world of pharmacy, the space of pharmacy has changed so much in that time that it's really caused myself and many of my peers to look into other things. And so probably about 5 years ago, I decided that I wanted to do something a little different. And it was because in the world of pharmacy, originally it was all about taking care of our patients, making sure you had the right patient taking the right medication for the right disease state. Well, now things have changed a little bit, and it's really more about how many medications can we get filled in a day? And it just felt like I was on a treadmill. And I was like, no, this is not what I want to do every day. I really, truly want to get to the root cause and help people. And so I started to do some research and try to figure out another route. And so actually the first thing that I did was I decided to become a personal trainer because I love working out. And I was like, okay, this may be an opportunity for me to do something a little different. Well, right after I got my personal training certification, maybe about 3 months later, I was diagnosed with lupus. And not only did I have lupus, I had lupus nephritis. And the unfortunate thing is that I really had been suffering with symptoms of lupus for probably about close to 10 years. I had been back and forth to the doctor, asking questions, trying to get some relief for various things. And I was just given excuses as to why I was experiencing the symptoms I was, and really was made to feel like it was all in my head. And so eventually it got to a point where my body just gave out. I went to get out of bed one day and literally fell to the ground. It just gave out. And so I called my doctors, and now, of course, everyone's in a panic, like, oh my goodness, what's wrong? Let's get you some help here. And so that's when I was diagnosed with the lupus nephritis. And I immediately was put on all of this medication, in addition to someone even suggesting that I be on dialysis. Well, I knew that wasn't for me. And so I started to take all of this medication. And unfortunately, I'm a pharmacist who does not swallow pills well. So the idea of taking medication was just traumatic in itself. But taking 13 pills a day was just unheard of. There was no way that I could sustain that. And so I started to do research and figure out other ways. With all of the doctor's appointments and the things that I did from day to day, no one asked me about nutrition, exercise, sleep, or stress. But everything that I was reading and I was learning was coming right back around to those things. And so I started to change those things for myself. You know, when it came to nutrition, for myself, I took meat off the table. I reduced sugar. I reduced dairy, all of those things that cause inflammation. And then I started to see a difference. And so as a personal trainer, now I'm creating a workout plan for myself and now being consistent. You know, before it was just all about work. And I had to change my mentality on that. You know, I had to learn how to prioritize myself and put myself first. And so that helped with the stress and the sleep. And so I put these things into place. And before I knew it, I went from taking 13 pills a day to now taking none for lupus directly. And I said, that's my light bulb. This is what I'm supposed to be doing, you know, because not only did I enjoy learning about it, but it really changed my life. You know, it gave me my life back. And so I wanted to be able to help other women do the same thing. And so that's when I decided to get enrolled into the IHP program and become an integrative health practitioner, which was one of the best decisions I made, because not only does it allow me to do what I love, but it allowed me to come away from that corporate America setting of being, you know, on that treadmill. How many prescriptions can I fill a day? Whereas now I'm really touching lives and seeing the difference that I'm making in women's lives. So that's kind of how I got from point A to point B.
Yes. I love hearing these stories. Never get old for me. I mean, they all have such similar tones, but they never get old, because imagine how many people, right, are still doing jobs that they hate just because they think it's the only way. They know in their soul they're meant to do something different. They're meant to touch lives, but they just never do it. And to know that, like, not only did you kind of think, you know what, like, pharmacy is totally not for me, but then you got tested, like this realm of what I'm doing, I want to do more. And so I'm going to be a personal trainer. And then you got sick. And so most people, or some people, might have thought like, oh, great. Now, like, oh, yeah, there goes my dream. I guess I'm just going to be sick. But you took your test and you're like, yep, I'm going to overcome this. And you're where you're meant to be. You like that was supposed to be your path to get you to the point where you can now have a really fulfilling job helping hundreds of women, I'm sure, on a weekly basis, get their lives back, because that's ultimately what we all feel, I think, is as health, integrative practitioners, is we either gave our own life back or someone taught us how to get our life back. We all got to the point where we were in despair. We are now so much better. We're so grateful that we're like, this is just what I'm going to do. I'm doing this from now on.
Exactly. And for me, it was really about just making that decision to prioritize myself. Before it was like everything was about work and, climbing that corporate ladder, taking care of the family, taking care of the household. And especially as women, we're taught to do that, like you can be a superwoman, you can do it all, but so many times we push ourselves to the back burner and we don't take care of ourselves the way we should. I think back and I'm like, all of those times that I went to the doctor and someone said, oh, no, you're just working hard, or all women are tired. I actually had a doctor tell me that all women are tired. And, if I had have just prioritized myself a little bit and said, no, that's not right, and was able to seek other answers, I may have gotten the diagnosis sooner. I may have been able to take care of it sooner. But at the end of the day, I don't regret the journey because, like you said, it brought me to this point, and I don't think without it, I may have had the strength to step away from corporate America, because you do question yourself. It's like I put all of this time and energy into becoming a pharmacist. What is everybody going to say when I just walk away, But I'm so glad I did.
Yes. Yeah. And I think you bring up such an interesting point, which we're kind of brainwashed in our society to think that like, just because something's common, it makes it normal. Like, yeah, are most women tired? Sure. Because we're living in a society where we're expected to be mom, nanny, house cleaner, laundry folder, personal chef. And most women are working, there's
Uber driver.
Yeah. Uber driver. Exactly. Yeah. Shuttle service. I mean, you name it. We have so many things mentally and physically that we're responsible for. And we live in a world where we're able to be so much, but that doesn't mean that one, we should, or two, that it doesn't take its toll. And yeah, most women are tired, but that's not normal. And that's not like, most women shouldn't just chalk that up to like, oh, well, this is my life, because it doesn't have to be. But we're just so many professionals, right? Like you're sitting in front of a doctor who went to school, probably a prestigious school, and we were taught to respect doctors. And certainly many conventional doctors are amazing, wonderful, do wonderful things. But sometimes the information that they feed back to their patients is not helpful in that way. And so imagine if you walked away thinking like, okay, I guess I'm just going to be tired forever. Well, here I go. But you knew you could feel better.
And originally, that is how I felt. I was like, well, she's a doctor, like she should know. So, maybe I do need to put my big girl underwear on and, just suck this up. And this is what it is. But, unfortunately, my body was like, no, this is not working. We have to do something different. And I'm glad I took the steps to do something different.
Yeah. Oh, so great. So I'm curious if we can switch gears a little bit, because I am curious how you so the CBD THC, I've interviewed another woman who kind of works in that realm too. And she does a lot of education, because you're right. It's the CBD is something now I think people are like taking advantage of just like slapping CBD on a label. Like if it's chapstick and they write CBD, like it could have 0.2% hemp, and somebody reads CBD and they're like, oh, I think I've heard this is good for you. So it's definitely like a marketing scheme. But then there's products that certainly have CBD, but are less quality, or they're not as full spectrum and they don't work as well. So I'm curious, is a majority of what you do kind of like education with your clients and patients, or is it more of a situation where you're, saying this would be best for, these ailments or whatnot?
I think in general, you can say like certain CBD products may be good for anxiety or, depression or sleep. But in our practice, we do try to make sure that we take an assessment of the patient and what their ailments are and what they're trying to treat. So then we can recommend the right product for them and the right dosage. A lot of times, you may have patients who get a product and they take it and they say, oh, that didn't work. But depending on your size, depending on, how you're taking it, when you're taking it, can determine if it works properly. And I think for most people, they just are not getting the education and the information that they need to take the products correctly. And so we spend a lot of time making sure that we're educating each individual patient. So whenever you do come and you purchase a wellness product, then you're going to get a consult so that it gives you an opportunity to let us go through all of your medications and make sure that you are taking the medication, how you should be taking it, and that you're taking it appropriately, because like I said earlier, a lot of times patients may be on a blood thinner and they shouldn't be taking the tincture, but no one's going to have that conversation with them if they're buying the CBD at the corner store. So.
Right. Exactly. Yeah. Okay. So I'm curious I think you touched upon it a little bit, but doing kind of such a big transition and dealing with, a health kind of crisis, so to speak, in the middle of it, what was your biggest obstacle for transitioning from, traditional pharmacy to what you're doing now? Was there one thing that you would kind of like say to our listeners, like, this is what I was up against? And if you are up against it too, like, this is what I recommend. Is there something that when you look back, you kind of think to yourself, like, that was hard and I kind of overcame it?
I think many times, especially when you're in a particular field or in corporate America, a lot of times we are taught to, at least in pharmacy, we are taught to show up and do whatever the necessary tasks are, but we're not necessarily taught to run a business. And so I think for me, it was just figuring out how to run a business. And so once I realized, okay, you don't have to know everything. It's okay to reach out and use resources. Things change. And so what I would recommend for any listener is to always have a coach. Some type of coach at all times, because it was at that moment when I got a coach that things started to move forward. Because then you have someone that you can bounce questions off and that just can help keep you focused and accountable. Whereas before, when you're trying to do it all by yourself, sometimes you just don't know what to do or, where to turn. Mm-hmm. And so just having that coach really changed the outcome of my business.
Yes. Yeah. And so many times, I think, again, when you're doing a million things, you're the Uber driver, the chef, all of those things, you don't like have the mental space. Like there's not another compartment for like, let me figure out how to run a business, start one, run one, and having like, outsourcing that almost mental load to somebody else to say like, this is what I'm thinking. This is my vision. Because you probably had a vision, but it was like, how do you execute it?
Oh, yeah.
Yeah. And executing it properly is what a coach or somebody that's already done it can do, right? Like we all believe that our clients should be hiring experts to help them with their medication, right? In your circumstance,
exactly.
Yeah. You weren't an expert at starting a business, so you hire a coach. And it really does take the mental and like emotional stress of like, how do I do this off the table? And it makes it more of a reality.
Right. Absolutely. Yeah. And so what I found is that not only I've had a business coach, but I find other coaches in other areas that I may want to do. It's nothing wrong with going to the expert. So right now I'm working on creating a podcast. So I have a podcast coach, and so have a coach. Definitely invest in yourself. Again, it comes back to prioritizing yourself and prioritizing your needs. And being able just to make things happen.
Yes. Yeah. As you were talking, I was thinking to myself, it's no different than if you have a restaurant, right? And you start the restaurant and great, it's going well. Well, like these tables and chairs are a little dingy. I'm going to like take my, profits and reinvest in some better furniture. So
right.
The restaurant looks a little bit more like you're constantly reinvesting back in yourself, which is the face of the business. And then it's, continuing to grow in a much more beneficial way.
Absolutely.
And at the end of the day, you're taking care of yourself. And like you said, I always say to, my clients are like, well, what do you do to, to keep your stress down? Or if I don't have a good answer, they're not going to take my advice. I'm just telling them to like get better sleep. Well, if I'm, staying up all night and I'm burning the candle at both ends, they're going to be like, who are you to tell me to sleep better? So you're also, taking care of yourself, but then it's also a way for you to relate to clients, for you to, be an inspiration to them if you're doing what you need on your end as well. It really comes full circle.
And that's one of the reasons that I decided to work directly with women. For several reasons. Number one, because I'm a woman and I felt like I could relate to them, especially when it comes to the chronic fatigue syndrome and autoimmune disorders. So that's what I mainly focus in on, is chronic fatigue syndrome and autoimmune disorders. But also, women have such a strong force in the household. They make so many of the decisions. So if you can connect with the woman, then you're also able to help that woman to make changes when it comes to nutrition and exercise for her family. So as you're healing mom, or you're healing the wife, then you're also healing the family. And so that's kind of how I look at it. And that's why I really try to focus in on women.
I have never heard somebody describe it that way, but that is so true. I've never heard somebody say it quite like that, but you're right. Most women are deciding what food's being bought. Most women are deciding, what supplements are being taken, or what the kids are taking to school for lunch, or what water they're drinking. And I never thought of it like that, but you're right. If a woman is better educated and feels empowered, she's going to make better choices, even if it's one child, for the children that she has at home. And then that's going to be our next generation. And what better like ripple effect than that?
Right. And I really noticed it. I have two young daughters of my own that are 7 and 9. And so they've always been very active. They're dancers. But once I became a personal trainer and they were able to experience that along with me, I saw that it completely changed their mindset. So now it's like, oh yeah, I want to go and work out. I want to go to the track. They're asking, when can they do these things? So yeah, definitely. When mom brings in a new idea, the family is going to latch on because mom said.
Yes. Yeah. It's so true. And kids primarily learn by what we do. I mean, they don't listen to hardly anything. At least my kids don't listen to what I say. But I hope that they're paying attention to things that I do. And they also, mine are a little bit younger, 6 and 4, but my 6-year-old will always say to me, like, we were actually at a friend's house the other night and somebody was talking about like vegetables. And he was like, oh, well, my mom's going to know about vegetables. She's a health coach. And I was like, oh my God. Okay. Other people know about vegetables too. But there's a sense of pride too. Like he sometimes is like, oh, my mom's an expert on that. Just ask her that question. Or, some kid will ask him like, well, why can't you have candy with dye in it? And he's like, well, my mom knows. And he gives them a little spiel, but he does like kind of look to me to be that anchor and be that education and that like sounding board for all of those things. So you're right. They start to kind of like notice what we're doing. They trust us. We're their moms. And it's just a continual, like amazing path forward.
Yeah. And people always say, you think your kids aren't listening, but they're listening.
Oh my word. They're always listening.
Yeah.
Even when they're 3 rooms over, they're always listening. I'll get a question. Like, where did you hear that? And then I remember I was on the phone talking about something, 2 days ago. They just, remember it, store it.
Yeah, I love it.
Yeah. So if you I love to get like resource, favorites from people. So whether it is like a, holistic approach to pharmacy, that a book that you love. So obviously maybe you've read The Rain Barrel Effect, you've done IHP, something kind of other than those, because a lot of our listeners are probably familiar with that, but maybe like a resource on CBD that you love, or any books, podcasts, Instagram accounts, like anything that you love as far as following or inspiration?
Let's see. So I try to read a lot of books or listen. I'm into the Audible books right now. So I'm listening to books instead of actually reading them.
Because you can chauffeur and listen.
Yeah, exactly. But one of the books that I'm finishing up now is called the Medical Marijuana. And so it's a really great book for anyone who's interested in CBD and THC, just so you can get a better understanding of how it works in the body, as well as what interactions it may cause with other medications that a patient may already be on. So I've found that it's been super useful, and it's definitely something that I'll be referring to on a regular basis.
Okay. Yeah, that's great. And then as far as I would love for you to share with our listeners, like your social media account and your website, all of those, places where they could find more.
Yeah, absolutely. So definitely reach out to me on Instagram. I would love to connect with you guys. And you can find me at Dr. Corine Ferebee on Instagram as well as Facebook. And then definitely reach out, touch bases on my website. It's www.drcorineferebeeconsulting.com. And there you can find any of the integrative health and functional medicine programs, as well as CBD and THC products, if you guys are interested in those.
Okay, that's great. Thank you so much for being a guest on the Integrative Health Coach Success Podcast. It was so great getting to talk to you and get to know you. I appreciate you sharing all that you did with our listeners.
Yeah, you as well. Thank you guys for having me so much.
Our pleasure. We'll be in touch soon. Thanks, Corine.
Thank you.